Welcome to another episode of Translating Health, a Frontiers CTSI podcast. Today we're joined by Doctors Emily Hurley and Drew Fox from Children's Mercy. Why don't we start with each of you telling us a little bit about yourselves and what your roles are within Frontiers? We'll start with you, Dr. Hurley.
Sure. I've been here at Children's Mercy for about 8.5 years now. I'm now an associate professor. I first came here as a postdoc, building off of my training in public health. I got my PhD in international health in a very interdisciplinary program, focused on social and behavioral interventions. Prior to that, I was a Peace Corps volunteer and a psychology major, and have really found my way in science through lots of different disciplines. And it's been fun coming to Children's Mercy. As a postdoc, I worked under Dr. Kathy Goggin with some of her international work, but also started to build up support for qualitative and mixed methods research across any discipline in the health sciences that could use it here at Children's Mercy, and then in the Frontiers Network as a whole.
Wonderful. Dr. Fox.
Yeah. So I also have a little bit of a circuitous background in some ways. I'm at Children's Mercy now, and I've been for 5.5 years. And previously, I was at KU Med for a postdoc that turned into a senior scientist position. And the postdoc before that was at KU. So I've been at a lot of the different places that are part of Frontiers. I am originally by training a PhD in experimental psychology, which was the focus was on behaviorism, and we did rat and pigeon studies. So that was all of my original science training was in a rat and pigeon lab that I ultimately was kind of in charge of. And from there, graduated to eventually my postdoc at KU, where I was doing more rat studies, and that turned into doing similar studies with people when I started doing my brain imaging research that I got brought into at Hoagland Brain Imaging Center, which is now Hoagland Biomedical Imaging Center, in a building that no longer exists, but they're, I think, currently housed in Fairway. So I moved from rats to actual clinical research with people, doing MRIs, doing fMRI. And then that sort of got me also, so I had co-mentors for that, and with Delwyn Catley, which is what got me to Children's. And he is more of a health psychologist, so that got me into doing more broader sort of public health adjacent health psychology research as sort of his helper and his mentee. And that's still what I do, and I work with different PIs at Children's who do public health related research. And Delwyn is the one who got me into team science, because he was the one who was the co-lead at the time when I came to Children's. He was the Frontiers, one of the co-leads, and decided that I, as his helper, was the right person to tab for helping him with the team science navigator role. So it was sort of by accident that I got into doing team science.
Well, as the team science co-lead, I am, along with Tara Fizzino from KU Lawrence, we are the two faculty members leading the team science function, but Drew is the navigator. So he is the one that actually has most of his time dedicated to this, and he's doing these collaboration plannings. He's setting up the events. He's really the person that has that center navigation role in team science, and Tara and I help to lead the direction that we go with it.
Great.
Yeah, my official role is the team science navigator, and what that means is, like, so basically, I'm the one who has covered time to do team science stuff. Essentially, I always like to call it team science stuff because it's hard to categorize it with a better term. But so it's, a little bit of administrative stuff just for, what we're doing, and liaising with Frontiers itself. It's a little bit of now more and more being part of the team science sort of scholarship community, which is the science of team science community, or sites they call it sometimes. Um, it's obviously being the one who helps people with requests related to team science, any kind of consultations, questions about collaboration planning, people wanting to set up collaboration plannings, and then actually doing those sessions. That's me. And any other kind of opportunities to present, what we do at other groups. So sometimes that means the K scholars, they have the Scholars Club. We come and talk to the Scholars Club. We've been doing that once a year for the last couple of years. So that kind of thing. And I always have a hand in those things as well.
Okay, so Dr. Hurley, you said you were part of the Peace Corps.
Mhm.
Can you tell us maybe a little more about how that's has that shaped how you approach research? Anything like that?
Oh, absolutely. Um, when well, the Peace Corps changed a bit since I've been in it, but when I was in it, they really emphasized not doing anything at first and just immersing yourself in the community
Yeah.
and learn from them. Spending the time learning the language, spending the time just being a part of the community that you're living with. And it's only after a lot of that time then you can start to talk about ideas for projects and ways that you might be able to help out. And as a scientist and as a team scientist, I think that process is very instilled in me to try to understand the community you're working with, the culture you're working with, and to be as much of a part of that as you can. There was a saying in Bambara, the language I learned when I was a Peace Corps volunteer in Mali, somewhere along the lines of, no matter how long a log stays in the water, it will never become a crocodile. Which is to say, you can spend as much time in a different community as you can, but you'll never really be a Malian. You'll still be an outsider. And in team science, I think that is still to take in as heart. We can work with communities and spend as much time with it, while also knowing that, we have another perspective that is instilled in us that won't completely change too. So this being an insider and an outsider, and at the same time, and negotiating that, it's what I think is exciting about science coming together with people that have different backgrounds, different ideas, and stepping out of your comfort zone a little bit to do new exciting things.
Yeah, that's such a, I don't know, I haven't met anyone else who's had kind of a similar journey that you've had. So it's really fascinating to hear about that.
I joined the Peace Corps right out of college, really drawn to the field of international health and wanting to get that on the ground experience. And through the 2.5 years I was in Peace Corps, it's when I really did decide I wanted to go into graduate studies for public health, international health specifically. So I went and got my master's and continued on to my PhD. I actually did my dissertation work back in Mali, where I did my PhD program. And I'm lucky enough now to still have work in sub-Saharan Africa that I balance with my work in Kansas City.
I was going to say, yes, you've still maintained those connections.
Yeah, and it's become more and more challenging to do work in Mali, where I did my Peace Corps. Politically, it's gotten pretty devastating, and I still keep those connections on a personal level. But scientifically, I have projects, close collaborations in Uganda, most specifically, and kind of continuing my work in international health communication. And until now, we have been very lucky with NIH funding. We continue to look for ways. It's getting more challenging as things are changing with the NIH, but anybody who has done international collaboration, just, it's valuable on all sides. So I very much hope that we continue to get the opportunity to do that, because it's good for everybody. We all learn from each other. And as much as we can step outside of, the settings we're used to, my time in Uganda is always just very enlightening, because my colleagues and I just get really excited about sharing ideas from across the world.
That's great. So the topic today is team science. So probably we should touch on that as well. So it sounds like the nature of your work is very collaborative and team oriented, which completely makes sense. If you're, working with international teams, you need feet on the ground everywhere. But I was wondering if you can tell us a little bit more about what team science is and why it's so important in research. And that can be either of you answering.
I always think of it, I remember Drew. The reason I picked on Drew is because I hear him in my mind saying, it's not just a bunch of scientists getting together. It is really reaching across disciplines. It's bringing people together that might have different training and different backgrounds, and being able to function as a team where people have their roles and their respect for each other worked out in a way that you can do more together than you could do on your own. It's beyond the one lab in the one department that's always kind of doing their projects together. It's reaching across, and it's bringing in ideas, methods, languages that might not always be seen together, but when put together can really lead to exciting breakthroughs that we wouldn't otherwise have. So yeah, I picked on Drew because I could hear you in my mind saying in a presentation saying it's not just this, it is really that interdisciplinary teamwork.
It sounds like it's not just, we've got all these different members of the team and we're learning how to work together and establish roles, but also how to share methodologies and approaches as well. Is that right?
Yes, at least that's how I see it.
Okay, we'll let Drew figure it out. So I also am kind of thinking about team science and the next generation of scientists, and kind of how training can tie into team science. And I think some of what you both do is help with leading discussions and training groups. But I wonder if you could talk a bit about maybe how, like, newer researchers, junior faculty, what have you, how they can kind of approach and establish these teams and collaborate and things like that.
For people building their careers, a couple of thoughts come to mind. One, I think it's super valuable to build a skill or two that can be useful across a lot of disciplines and to a lot of different teams. Not only will that make you yourself valuable, it will expose you to a lot of different research. So if it's a method or some, experience that you have that could be very transferable and useful to a lot of different research teams, it's a great way to build your career. I think in, finding yourself on research teams and building research teams as well, one of the things that we try to do in the team science function is flatten out the hierarchies at the beginning so that roles, understandings, all of that can be written out in a way that helps the team function in the long term. Are there hierarchies in research? Absolutely. But when we're first starting out and we want a team to function, we need everybody on the team to speak up and really come to the same place about how they're going to work together well. And I think if you are even starting out your career, finding yourself on a research team, the collaboration planning that we do in team science is a really great way for everybody on the research team to come together. Drew facilitates these as an external facilitator, so it's not the PI leading the meeting, it's somebody else. And suggesting this to your research team or even reaching out to us to set that up would be a really good way for you as a junior researcher to make sure that, you know, team science is practicing in a way that benefits everybody, including you, especially if you feel like, you know, a different sort of setting would help make your voice heard alongside everybody else in the research team as well.
Yeah, that makes sense. That seems like it would be such a kind of a leg up in starting your career to have the ability to have those conversations and make those relationships. But if someone is interested in setting up a collaboration planning meeting, how can they go about doing that?
That is a great question, and it's not too hard to answer, but it is Drew. You can reach out to Drew directly, or if you go on the Frontiers website, there is a bit about collaboration planning, a little bit about what to expect. There's even a short video. Collaboration planning has been developed and implemented throughout CTSAs across the country, and Drew's been very involved in that as well. But there is a form too that you could fill out if you want to go directly there, or just contact Drew and he'll make sure to set you up with the resources that you need to get that started.
Great. Is collaboration planning for all stages of research?
Well, luckily, we have been tracking, and what we've learned is the teams that do this really do find it valuable. Every kind of role from the data collectors to the PI, they really do get very high readings, which has been really great to see. The other thing we have found out from a recent survey we did throughout Frontiers is one of our biggest barriers is people don't know about it. And so we're really trying to get people to learn more. You know, they are 90 minutes, which can be hard to schedule. We have done some where we've put it into 60 minutes. Getting a whole team together can sometimes be hard. We thought these were the biggest barriers, but really we learned the biggest barriers is just getting the word out. And once people know about it, they find it really, really helpful. So uptake has been pretty good, but we definitely want more teams to reach out to us and make use of this. It's typically done at the beginning of the study, but it doesn't have to be. If you're in the middle of the study, you want to kind of take a pause and make sure that your systems are working and your teamwork approach, everyone's on the same page. It can be valuable at any point of the study. So you don't have to feel like, you know, you're just waiting for that big study to start, you know, 6 months from now. You can make use of it at any time. We've also done a number of follow-ups. So with teams that did an initial collaboration planning at the beginning of their study, 6 months down the road, 1 year down the road, have come back to Drew and have done a refresher on the collaboration plan they've made, revisited it, talked about things that might need to change now that they're further down the road.
Yeah, and just to, yeah, you're absolutely right about that. And Betsy Rowland intended for the collaboration plan that you produce in a collaboration planning session to be usable as a collaboration plan document that you put in a grant, which whatever there's a slightly different term they use for it when you put it in the grant, but because most people just kind of use kind of a boilerplate thing for that, and don't spend a lot of time thinking that through. But you can strengthen your proposal with a, you know, filling that out a little more thoroughly, and all it takes is, you know, a meeting.
Yeah, so it sounds like this is a good opportunity at kind of any stage in the research process then.
Yes.
Yeah, pretty much.
So-
I always tell, I mean, I always, like, once you have a specific project in mind, like that's anything at that point and beyond is when it is most useful, which is, you know, the vast majority of the project at any time.
Do you, for the collaboration planning meetings, is that virtual? Is that in person?
Yeah, it's flexible, but just as the way it has gone, I've only done them virtually. So, and I mean, that tends to be easier to schedule, especially when you have teams that are in multiple locations. Obviously, it's easier to just do the virtual meeting. So that's the way it has always gone.
That makes sense.
Yeah. And it
Yeah,
works pretty
certainly.
well.
Great. It certainly seems like some of the topics that Dr. Hurley was talking about are just easier when you talk it through rather than, emails bouncing back and
Yeah,
forth.
that's really a lot of it. That's really a lot of the crux of what it is. It's just like walking through some of the questions that everybody has that sort of don't always necessarily get answered or kind of just implicitly get answered just by the way things are going, or just never get answered and leave people frustrated. You just talk them out. Yeah.
Yeah. Okay, another question that comes to mind when we think about clinical and translational research, we talk about kind of the translational spectrum. And this might be kind of an obvious question, but I'm going to ask it anyway. Does kind of the concept of team science apply across all across all stages of the translational science spectrum? So, bench science
Yeah.
all the way into population health.
Yeah. Yeah, it does. And that's really where team science kind of lives its most important role in translational science or in translational research, is helping to cross those wider bridges between
Yeah.
scientists who do very different kinds of research. So, like, you've got a physician who has access to patients, and wants to study a new, I'm trying to think of an example of, they give antidepressants to teenagers, and they want to know, what is the best dosing, what's the best outcome you can get, but the drugs don't work as well as you want. So uh, you want to like do an experimental, therapeutic type of thing. You bring in something that apparently is called an experimental chemist, who is a person who can literally make the new compounds that you can then test. You're bridging a wide gap of science there. That's, going all the way from a person who does the basic science and knows like the very fine-grained detailed chemistry and how to like create new molecules from scratch, to a person who might be involved in giving them to patients and then studying the outcomes. Those two people don't speak the same language other than the intersection of like knowing what the drug is. Um, and then there's a lot of steps in between. But so that's really where team science principles become the most helpful, because you're you're helping people have conversations where they realize the differences between their fields, where the norms are different, where they might clash, and then have conversations about how you can smooth those over. And where they clash can be like the norm in one field is where like who is an author on a paper, and how you do the authorship order is a totally different, say, from the way a psychologist does it, the way that
Right.
we're trained to do it. Those norms being different creates conflict inherently. There's no way around it when you're doing, a study that goes across disciplines like that. And so rather than it turn into fighting when one group just forges ahead and does it the way they do it, and the other group is like, what is going on? Which is the way it happens a lot of the time, and causes bad blood. Team science is trying to get people together, hash these things out, talk about it, figure out how you work around those differences. So that's just authorship is an example where it comes to a head.
Yeah.
But there's other things like, how you handle data, how you decide who's going to present at a conference, who's going to pay for the poster, like all those things can be different norms across different fields. And that's
Yeah.
where you get conflict. Just inherently, just the nature of things. I mean, conflict is the nature of things on any team. because you always have different personalities, you have
Sure.
different leadership styles, you have all that kind of stuff. But in addition to that, you have, fields of science that have different norms. So rather than just letting them clash and causing problems, we try to in it, try to have an intervention that helps bring people together and smooth those things over before they become problems. Yeah.
Yeah. That's a great answer. That makes me
Yeah.
feel a lot better about the quality of the question.
Yeah,
It's a
no,
very good
it's a
answer.
great question. Yeah, no, it's a perfectly good question, and yeah, it's very you'll never have, the goal of like that sort of transdisciplinary science where you're really creating a new science out of mashing different sciences together. You will never have that without going all the way across that translational spectrum and getting people to talk to one another. Getting them to talk to one another is a whole different thing, but like once they start that process, there are things we can do to smooth it out. Yeah.
So, Drew, you're pretty involved, or Dr. Fox, you're pretty
Mhm.
involved with
Yeah.
kind of the
It's
broader
nobody calls me Dr.
CTSA.
Fox, so it's fine.
Okay, it felt really weird to
Yeah,
say.
it's all good.
Um, but you're involved with kind of the broader CTSA
Yeah.
network and the team
Yes.
science, and you're talking about the science of team science.
Mhm.
Can you tell us what you do at kind of that higher level
Yeah.
as well?
Yeah. So, there have been a couple different initiatives that I've been a part of that are being led by other people that I've sort of been able to come in and contribute to. So, one of them is a paper that was started and is being led by some people out of RENCI, which is the Renaissance. Oh, I'm going to get it wrong. Renaissance Computing Institute. I think that's what it is. And they're team science adjacent, but a lot of what they do is team science stuff. And they came to the Science of Team Science conference and invited a bunch of us to this writing workshop. And that morphed into a paper about barriers and aids to effective communication in team science. So I volunteered to help write some of that paper and work on it and edit it and stuff. So that's a paper that's gone in and is in review right now. So that's one project. The bigger one that I've been a part of is the newly formed Team Science Professionals Special Interest Group, which is officially a part of ACTS now, uh, and as of last year. And since I started being active in it about a year and a half ago, the current co-chairs, or actually now previous co-chairs, wanted new people to step in and start taking over. So I'm now one of the co-chairs of that. But the Team Science Professionals Special Interest Group is about the professionalization of team science. So there isn't really, it's in its very early stages, I guess I'll say. There isn't currently like career tracks for people who do team science or team science facilitation. Um, so we're kind of in the early stages of figuring out how to do that. The initiative that got me started is the digital badge initiative. So they basically created a credential for team science professionals where you can go online, do a series of trainings, apply for a badge that is then issued through ACTS. So that's a thing that we've been working on for a couple of years. I sort of jumped in the middle of that process and have been helping with some of the evaluation of that. So there will be a paper that I'm helping lead that will be, about the evaluation of that whole process. And we're thinking about what to do next after the digital badges. So it's all about the professionalization of team scientists themselves. That's the thing that I'm sort of working on most primarily as scholarship within the team science field. Yeah.
Yeah.
I don't know if
Thank
that
you.
makes any sense. It's a little wonky. But yeah, that's what that's that's what we're working on.
Yeah,
It's
no,
a pretty small group. Yeah, our SIG
yeah,
has about 100, 120 people. Some of the other SIGs are quite a bit bigger, but ours is pretty new. So yeah.
yeah,
And I do work with people from CTS, mostly from other CTSAs across the country. Yeah. So
yeah.
it's like South Carolina, Colorado, some people from Rochester. So like kind of all over.
Great. Yeah, we love hearing about how Frontiers relates to all the other hubs.
Yeah,
as
yeah.
well.
And I get to represent Frontiers. Yeah, that's right.
Yep.
I get to represent Frontiers with these other folks and put the Frontiers name on the scholarship, which is great.
As the
Yep.
incoming co-chair, or
Yeah,
current
right.
co-chair.
Yes. So, Dr. Hurley, you lead the formative research team at Children's Mercy. Can you tell us more about that?
Incorrect. We have changed our name.
Oh, no.
I should have told you before, but no, this is a good time to announce that we recently changed our name and we're going by the Qualitative and Mixed Methods Research Team. Formative research is still very much a part of what we do and the spirit behind what we do, but we found saying qualitative and mixed methods more accurately represents what we do and is easier for people to understand. So we provide the support for qualitative and mixed methods in research all around Children's Mercy and also the Frontiers Network. And we do this often in formative research, so qualitative and mixed methods that's going towards designing a health program or an intervention, but we also use these methods outside of formative research in all the different ways that they can help us understand translational science.
Great. Yeah, I knew about the name change and I had forgotten until you reminded me.
But this is a good time to announce.
Yes.
We're very lucky. We have experienced staff scientists on our team, and every part of a study, the lifespan of a study that involves qualitative and mixed methods, we can provide that support in from design to actually conducting interviews and focus groups and surveys in our bigger collaborations to analysis and dissemination. And we need our collaborators too, right? The amount of interesting questions that qualitative and mixed methods can lend themselves to providing insight on is, infinite and dependent on folks, observing, learning, seeing, questioning in their clinical and community practice. So we could not operate as on our own. We get to study so many really unique and exciting corners of science that we are exposed to through our collaborations. And it makes everybody better too, because when we learn, through the trials and tribulations of one collaboration, we bring those lessons learned to the others, and also just really really enjoy bringing ideas and people across the disciplines when they're meeting in the qualitative and mixed methods realm. So we collaborate, we consult, we also do trainings, and just overall trying to promote the use of those methods in rigorous and impactful ways, hopefully.
So one of the parts of what I do at Frontiers is help with dissemination. And I feel like recently I've had a lot more requests for, how can we effectively disseminate qualitative research? So maybe you and I can sit down at some point and talk about strategies for that.
It's one of my favorite questions, and also one of the most unique team science examples I've been a part of in doing that. We spoke about dissemination at Frontiers Research Day not too long ago, and one of the things I spoke about on the panel was my work in research-based theater, and that has been super fun. We've had the privilege of collaborating with theater artists to disseminate qualitative research. Not saying this is appropriate for every project, but using it as an example of effective dissemination of qualitative research can be a very creative thing, and also something that takes into account the audience that you're trying to reach. Qualitative research is about human experience. It's rich, it's about stories, and often putting it in journal articles is not always the the way that's going to speak to everybody that might want to learn from what you're learning.
Yeah. Yeah. It's fun thinking of ways to really try and translate that impact.
It's not unrelated. We're doing research-based theater this summer with Youth Ambassadors, a community organization with high schoolers. And part of the goals is just to kind of open up people's idea of what research is and what, it might have a value for you in your community, and looking at qualitative research as a starting point, because it is about the human experience, and we hope it can be something that people relate to and find valuable. Working with theaters in the past has been like a team science challenge too. Like everybody is like using different terms, different norms, but it's some of the work that my work has gotten most interest from people. And I think it is just because it's a unique collaboration. And so I really encourage people to take risks in team science and work with people that you might find are from very different walks of lives or professions, whether that's in the community or in sciences, because it's can be like a wild journey, but it also can really come out with things that are unique and really do, surprise people.
I love that. I usually like to close by asking, for a fun fact, or if there's like a specific story you remember as you're doing your research or going through your training. But I think, yeah, the collaboration with theater sounds fantastic. But if you would like to add any other fun anecdotes or anything like that, now is a good time.
Today at our team meeting, we have a new member as of 6 months ago. And her title is senior social scientist, Carrie Wendell Hummel. She told us she was catching up with her 12-year-old niece and said that she, had a new job and her title was senior social scientist. And this niece thought that was like, she said, that's such a cool title, so much cooler than whatever your title was, before. But then she asked, are you wearing a white coat? Like, that sounds so official. You have to like wear a white coat. And that just stuck with me a little too, because I do like, I think when we say science, people have a lot of different meanings about what that could be. And part of the fun of team science is challenging that and pushing the boundaries of that, and being social scientists. That she responded, no, but sometimes I wear a blazer. So like the scientists in blazers and the scientists in white coats and the theater people, like science is a place that like we can all meet. And I think we're all really starting to come around to that. And hopefully, the next generation of scientists, even if they start out as theater kids or whatnot, like see themselves being able to contribute to science in creative ways that we can only begin to imagine right now.
Yeah, amazing. That's fantastic. Drew, do you have any final thoughts you'd like to add?
I just want to add on to that, because I was going to talk about something else, but I want to add on to that instead, which is that there's a weird amount of overlap that maybe weird isn't the right word, because it's actually apparently pretty normal. An overlap between performing arts and science. There's much more so than you'd ever think, because than I would think anyway. Like just in my experience, so many of the scientists I've worked with have a background in performing arts also. So I worked with someone who was a dance major as an undergraduate. I worked with someone who has a degree in piano performance. I worked with someone who is a mandolin player in a bluegrass band. I worked with someone who, what am I forgetting? There's someone else who does music therapy and works with like a vocal coach in their research. And so there's like all these ways that it bridges together more than you'd think. I think the common thread is that a lot of us like we nerd out about what we're into, and I think you can appreciate you can always appreciate someone else who nerds out about what they're into. I think maybe that's the like the broadest common thread between like people who are performing arts and people who are scientists. And that's it. It's just like the ability to just focus on one thing and just sort of be a nerd about it and be all about it. So there's more of a bridge there than maybe would be obvious to most people.
Yeah, the linguistics major in me just wants to shout, it's all communication. It's all
Yeah,
about social
yeah,
interaction.
yeah, yeah.
So,
My partner is a communication major who used to do did ethnography research where she had to perform as someone else. So I have the, I didn't wasn't that's not even one of the people I was talking about just a second ago, but she's been part of that as well. So was a communication scholar, and so it all does overlap more
yeah.
than you probably think.
Yeah.
Yeah.
Well, thank you so much for your time. This has been a fun discussion on what team science is and its importance to research teams. Thank you for listening to another episode of Translating Health. This podcast is hosted by Dr. Heather Fielding Gebhardt and produced by Kelly Hale.